Smile killers. What are some of the things that will just absolutely kill your teeth and therefore your smile? Well, the first thing that people will always think of are cavities. And of course, cavities will kill your teeth. And there's certain times in life when you're most at risk for cavities. For example, kids. Kids are at high risk for cavities. They need to be checked out pretty often. The other time when people are at high risk for cavities is when women are pregnant. Several reasons behind that, but pregnant women are also at risk, increased risk for cavities. And the third time is generally elderly people, people that are on a lot of medications are also at risk for cavities. And so that's the first one and probably the most common one. If you ask people what puts their smile at risk, it would probably be cavities. The second one though is structural compromise of teeth. Let me show you what I mean by drawing a little picture. So here's a tooth. This tooth has no fillings, no cavities. This is the nerve in the middle of it right here like that. This is your tooth, nice healthy tooth. In this configuration, it's very, very strong. But right here is where you usually tend to get cavities right there. So traditionally the way those are fixed is that it just goes in, drills out a big portion of the tooth to make sure all of the cavities is out of the tooth, and then they put a filling in there like that. And that's fine for a while, but what happens with the biting forces on the teeth, even side to side motions on the teeth, you start to develop cracks in this area, the tooth will flex, you'll get percolation of fluid down underneath of the filling, it'll get a cavity underneath the old filling, or the tooth just may break in half. So this is one way that a tooth can be destroyed without having any cavities per se, and with even with good oral hygiene, that tooth will break and have problems. So this is very frustrating for people. They said, well, I brush, I floss, I don't have an ounce of plaque on my teeth, and yet I still have problems. This is one of the reasons why that happens. Now the last one that I want to talk about is tooth wear. We see this more and more, sometimes even with really young people, but people will tend to grind their teeth at night, and there's a variety of reasons about why they do that. But grinding your teeth at night will shorten your teeth and make them, you'll lose the aesthetic appearance, and you can actually have a lot of other problems depending on how much they're ground down. And the best way to treat that is with prevention. Once teeth are ground down and you have to go in and replace it or fix them, it's very costly because you have to treat most of the teeth in the mouth. The best way to fix that is, well, that's a long story. Best thing to do is have a consult with me, and we'll try to find the root of the problem why people are bruxing and grinding at night. And we'll also help you sleep better. Thanks for watching.